Hi, and thanks for tuning in. Last week, I shared information about how the coronavirus that causes COVID-19 is transmitted and what you need to do to stay safe while caring for patients with the infection. This week, I want to highlight what's being done behind the scenes to support our efforts to contain the epidemic and keep you safe. I hear a lot of wartime imagery being used these days, with care providers compared to soldiers on the front lines. As with any army, the quality of support for frontline efforts is critical. Quietly, behind the scenes, people throughout our health system and community are supporting our work to overcome the unprecedented challenges brought on by this pandemic. One of the critical challenges we face is the national shortage of personal protective equipment, or PPE. COVID-19 caught public health authorities by surprise. The virus didn't follow the pattern of SARS, Ebola, and other viruses that jump from animals to humans. Such viruses usually do not transmit very well from person to person, which is why they fail to spread around the world. Once rapid person-to-person transmission of COVID-19 was demonstrated in China, that country devoted all their supplies of PPE toward fighting the virus locally and effectively stopped exporting. China was the main producer of these items, so traditional sources of masks, respirators, gowns, and even the raw materials for medications dried up quickly. This sudden loss of supply happened at the same time COVID-19 was appearing in Europe and America, and it set off a competition that pitted countries, states, regions, and health systems against each other in a scramble to shore up supplies. Governor Baker has complained that the federal government was intercepting orders coming into Massachusetts for the federal stockpile. Baystate Health has had several orders either delayed or canceled, even while en route to our warehouse. Our supply chain team started exploring many unfamiliar and uncertain sources to acquire much-needed supplies. They've been in bidding wars against other states and even the U.S. Army. Prices have skyrocketed to 5 to 10 times normal, but the team continues to come through to get us much-needed supplies, even as usage rates climb as the case numbers increase. Currently, there are 20 people working the phones every day to secure new sources of needed supplies. In addition to colleagues throughout Baystate Health, there are countless community members stepping up to support the care you provide for them and those they love. Our foundation team has appealed to donors not only for financial contributions, but also for their connections to manufacturers and vendors of PPE, test supplies, and more. Trustees, business leaders, and elected officials are calling every day to help. They're reaching out for support from their networks throughout the country. We've leveraged our relationships with the Economic Development Council to put out broad-based appeals to manufacturers that have led to donations of tens of thousands of pieces of PPE. We've even persuaded some local manufacturers to retool their facilities to begin making PPE. Area businesses are today lending their large trucks to pick up PPE hundreds of miles away in other states. Testing challenges also have had a tremendous impact on our PPE and usage, as one national lab after another got swamped with requests and subsequently got backed up. Turnaround times for testing climbed to over a week. Waiting for results led to needless use of PPE for uninfected patients and delayed the return to work for uninfected employees. Very much like PPE, supplies of the chemicals needed to run these tests on site dried up, and supplies of sampling swabs ran low too. In order to combat these shortages, we've used creative means to get into contact with the CEOs of 5 separate companies and secured the intervention of both Governor Baker and Congressman Neal to get Baystate Health designated as a critical lab for COVID-19 testing. This opened up access to a lab with turnaround times of just 1 day. The political pressure also opened doors and got us the chemicals we needed to get up and running this week on 2 separate analyzer platforms. As more on-site testing becomes a reality, turnaround times will go down to just a few hours. This will enable us to expand the scope of our testing and keep clusters of cases from spreading more widely. We'll continue our steadfast efforts to secure steady supplies of everything we need for the coming surge and all that we need to support you and keep you safe in the days and weeks ahead. In times of crisis, we've relied on our friends to open doors, exert pressure when needed, create new sources of supply, and donate resources that are critical for the fight. Through their willingness to help, we've come to realize how important Baystate Health is in their lives. They're doing this because they believe in you and see your dedication to your patients. They're rooting for you to succeed and to stay safe. I hope you can feel their support and that of the entire Baystate Health organization, and that you know you're appreciated and valued. I promise to continue my efforts and the efforts of all who are supporting you in this fight. And I thank you from the bottom of my heart for your efforts, your commitment, and your sacrifices.